We're going to talk today about the arch of the foot, how to actively engage the arch, the ins and the outs of that, and how to modify as needed and integrate into functional movement patterns like walking and weight shifting and other things, okay? And squatting maybe as well. So the arch has three pieces that we want to be aware of functionally speaking. So we want to think 3 points like a tripod. It's the heel, pinky toe knuckle, and the big toe knuckle, which on the foot is up here more, not down here, okay? So basically those 3 points create this nice tripod with the arch of your foot in the middle. And the arch, of course, is where you want to make sure your weight. So we talked in other videos about like the button on like my shirt here, which is hard to see because it's all black, but the button here near where my sternum is. Over when you're sitting, it's like your belt buckle area, so button over buckle. And when you're standing, you want to think button and buckle as well as the boot or the arch of your foot, which you think of like the boot, so 3 Bs. But specifically, you want to make sure that your button is over your boot or your arch, the center of your arch, like where your shoelaces are, when you are shifting weight and balancing, especially with walking, when you have to hold yourself up tall and be on one leg for a period of time. All right, so we're just gonna kind of go through. I'm gonna bring attention to what of those 3 points I'm talking about and how I'm getting there, and then piecing that all together with loading and weight shifting. So here we go. So what you can do is you can do this in supported position to start with. So right now I have a step. You can use stairs or steps at home. Just make sure you have a railing to hold on to, or maybe 2. Or you can use a wall in front of you or a counter in front of you and have a step stool. Okay, this one is a little bit short, but I can stack, it's stackable. It's an exercise step. I could put a couple sections underneath it to make it about 8 inches tall, 6 or 8 inches tall. But the point of this is so when your foot is there, you can keep most of your weight on your other foot, and then again, like have railings or something in front to hold on to. So we want to make sure that we are supported and stable, and that we can shift our weight and control that shifting with more intention and awareness, okay? So that's what I'm going to show, is think about how to get to the heel first. So I'm going to swivel, through the T-plane, I'm going to turn, twist through my torso to get my pelvis to come back, and in doing so, my hip goes back, and I'm also going to flex, which is more in the S plane, okay? The swing plane, the twist plane to the swing plane. So it's my obliques to my glute max to target that down to my heel, also through the S plane. And you'll see my knee comes out. I don't want it so far out, because what will happen here is my inside toe knuckle will lift up, and then I roll my ankle and lose my balance. So I don't want to collapse in here, and I don't collapse in there. So I want to control my T, the twist of the hip, and I want to stabilize now on the outer muscles and the inner muscles on the F plane, the flat plane, okay, there. So I'm going to twist obliques to glute, down to my heel. I'm going to stabilize with my gluteus medius, down the IT band, as well as the inside muscles here. This is where we have the VMO, a portion of your quadriceps, the inside quadricep, which ties in with these adductors here, although the quads are a S plane. So again, we're kind of stabilizing in all 3 planes to lock in here. And down at the foot, those correlate. So my hip, the swivel, twist, glute to my heel. I'm gonna be twisting enough just to level that of my hip to get into my pinky toe knuckle, with the knee in line more with that. And then I'm gonna anchor from here into my big toe knuckle. Now there's a muscle here that actually wraps around underneath and attaches and pulls that knuckle down. Okay, so that is one of my muscles here, and these muscles, the peroneal muscles, and those muscles are for eversion motion, but we don't really want the motion. But when I put my weight here, I want to push out like as if I'm doing that, help to lock that in. And what I get is a twisting. I'm pushing out here, but it's not moving, but instead you'll maybe see here as I swish out, my big toe knuckle actually naturally comes down with eversion. So that's midfoot pronation to complete the arch. So I kind of get that arch lock going. So lock it in, and then your weight, your chest over your foot, and then, you know, that's what you're trying to get. So in walking then, step, twist here just to get the knee there, stabilize to the 2 sides, and I'm gonna push my toes out without them moving. They're gonna just tension, and it's gonna twist. So that's actually an F plane motion there, versus this is your twisting through the ankle without the movement. It's more stability, but it actually moves down in the F plane to lock the big toe knuckle down. Lock it in, then I can squeeze and lift. Step, lock it in, squeeze and lift. I can also practice like squatting, like both sides together. I can shift side to side, almost like golf swing. But feel that, back and forth, step, back and forth. And that's with the whole deal, with the whole locking in, the arch lock, and the stability, and just feeling the balance of everything, keeping your weight as you twist, turn, and sit and stand through your whole body there. And that should give you a much better sense of control and stability and balance and all those things that you're maybe lacking